keep in mind the majority of the uninsured are people who are in employed situations. 75% of those who are uninsured actually work, are in families where there is a working individual. Do not think the majority of people who have no health insurance have made a conscious choice not to get it because they don't want to. It's an issue of money. They simply cannot afford it. Being uninsured really is as a result of a person's economic status, their economic state.
We have individuals who are working, and although they are maybe on a full-time job, the employer may not offer insurance, or they are working part-time and health insurance is not a benefit available to them.
Those people will have to be cared for. We either do it one way or we do it another. At the present time, it's a very poor way because it's so costly to do it. If we could get a system where the uninsured or the underinsured people were being cared for in a minimal way, as best we could with basic services for basically everybody, then they wouldn't be going to the emergency room and running up astronomical costs that have to be shifted to somebody else.
Central Oklahoma Integrated Network Systems is an organization that works to have physicians join with one central agency so that when patients who are uninsured need a doctor, need a physician, and particularly a specialist, physicians are listed on a roster and they are called then to see patients, but they have to be referred through health centers like Mary Mahoney or other agencies that are part of the system.
Coins is able to do this in an organized fashion, so people can realize and see the practitioner that they need and realize that they can have access to this care.
And entities like the Central Oklahoma Integrated Network System that are trying to find health care for the uninsured and underinsured people in the community is one of the better ways of doing it. What we'd like to do is we'd like to recommend to healthcare providers all across the spectrum in Oklahoma County and the metro area to be available to take on some of these clients free, pro bono if you will, and to refer the questions to them personally about, well, would you take care of us? We don't have any money. Refer them to Coins, because Coins will then spread them out over the community to the different providers. And they're providing a system, and there's a system set up to manage those folks that really need care and are coming to those individual providers to seek that care.
So we rely totally on our partners who collaborate with us, such as physicians, such as hospitals, such as laboratory or diagnostic laboratory businesses or organizations to provide the services that we need so that we can link patients to the services that are needed or requested.
Coins is helping to coordinate the efforts so that one physician doesn't see all of the gynecology patients that need to be seen, but it's spread among the gynecologists of Oklahoma County, and likewise with other specialty practices.
I have heard through the years that if every physician would be willing to take about 10 uninsured patients a year and take care of them, we could cover all of the uninsured in the United States of America.